If you have breasts and you're a man, you probably want to stop having them. This problem doesn't just happen to you, it can affect up to 70% of men at some stages of life. It's not always caused by excess fat and high body weight, despite popular belief. It can be a sign of significant underlying diseases such as liver or kidney disorders, and among its causes can be some unexpected ones, like the shampoo you wash your hair with. While it won't kill you, this problem, especially in young people, generates a huge emotional impact and deterioration of self-esteem. Today we talk about gynecomastia and its solutions. Gynecomastia, derived from Greek words meaning female breasts, refers to the development of breast tissue in males. It is the increase of mammary glandular tissue in males, often associated with pain in the region, sensitivity or discomfort. There are many causes, and today you are going to understand them, but fundamentally it is due to a sustained imbalance over time between the main male and female sex hormones, androgens and estrogens. It is a typical problem during periods of life when hormonal changes occur, such as adolescence or the decline of sex hormones at the end of life. Interestingly, it can even occur at birth due to the passage of maternal estrogens. It's important to differentiate gynecomastia from another different problem, pseudogynecomastia. This occurs when there are excessive symmetrical fat deposits around the areolas, primarily in patients with obesity. Because, as I had told you, gynecomastia is an increase in mammary glandular tissue, of the mammary glands, not of the fat in the breasts. This glandular tissue responds to estrogens which make it grow. Is gynecomastia common? It's very common, but usually temporary. Up to 70% of boys in early puberty between the ages of 10 and 14 develop some degree of gynecomastia. Why? Because of the hormonal changes of puberty. In most cases, it resolves itself. However, in men over 70, up to 65% are also affected. What are the most common causes? Well, as we have said, pubertal gynecomastia, especially the one that does not resolve over time, which occupies a third, the one caused by drugs or supplements, occupies another third, and here are included anabolic androgenic steroids, which I will explain later why they generate gynecomastia, and then the so-called idiopathic gynecomastia, which also represents approximately a third. And what does idiopathic mean? It means the reason and causes for its occurrence are unknown. Also, in a smaller percentage of cases, the cause is a disease like hypogonadism, hyperthyroidism, liver or kidney failure. Also hormone-producing tumors, but this is rarer. Earlier, I told you that there was a category that was drugs and supplements, drugs and supplements. Well, as for the drugs that produce it, they are the following. Pay attention. Spironolactone, a widely used diuretic, ketoconazole, an antifungal, cimetidine or ranitidine, which are HE2 blockers used in digestive ulcers and gastroesophageal reflux, for example, antihistamines in general, which are used in allergies of different types. As you can see, blocking histamine receptors could generate this problem. Anti-androgens used in some prostate cancers, in fact, almost 75% of patients who take them end up developing gynecomastia. Antiretroviral therapy for human immunodeficiency virus, recreational drugs such as cannabis and frequent alcohol consumption, and also finasteride, a 5-alpha reductase inhibitor used in androgenic alopecia, although it is not common for it to produce it. As for herbal or pharmacy products, lotions or soaps and shampoos with tea tree oil or lavender oil. These vegetable oils contain estrogenic compounds that in susceptible people and in the long run can generate gynecomastia. It's not a matter of applying that shampoo or that oil once and getting gynecomastia, but of consumption, a use, a continued exposure over time. And what about soy-derived products, Borja? Do they cause gynecomastia? Tempeh, soy milk, natto, tofu, soy sauce, miso, edamame, textured soy. Well, they don't cause gynecomastia unless they are consumed in high amounts and, once again, over a very long period of time. In vegan diets, where the main source of protein is soy, it can play a significant role, especially if there are also other factors that imbalance androgens and estrogens. Eating edamames once a week will not cause gynecomastia. And now returning to the question I posed to you earlier, why do I have gynecomastia after a cycle of anabolic steroids? Well, this is a very common side effect, almost guaranteed in steroid users. It happens after finishing the cycle, not usually during, for the following reasons. After a sufficient time exposing your cells to supraphysiological concentrations of androgens, more than what your testicles would normally produce, there is what is called an axis blockage. What axis? The hypothalamic pituitary testicular hormonal axis. In this case, LH and follicle-stimulating hormone are reduced to practically zero. Remember that LH is needed to naturally produce testosterone. You would think that once the doping drugs are removed, the axis would reactivate spontaneously and immediately. Well, no, it doesn't happen like that. The axis takes weeks, sometimes months to recover, and sometimes it doesn't recover. In that time it takes for the axis to start, you don't produce enough testosterone on your own. And since you're also not injecting it because the cycle has ended, then what happens? There is a very large imbalance between androgens and estrogens, which is the fundamental and ultimate cause of gynecomastia. But there's another reason. During and after a cycle, you're aromatizing excessively. The aromatase enzyme transforms testosterone into estradiol. When there's an excess of testosterone, your body defends itself. It tries to balance it with estrogens by aromatizing it so that the estrogens increase and the testosterone decreases. But when the testosterone levels drop later, the aromatization continues for a while, again unbalancing these two hormones. That's why bodybuilders use selective estrogen receptor modulators like tamoxifen or other aromatase inhibitors like exemestane, both drugs used in estrogen-sensitive breast cancer, and of course it's not justified to use them outside of those indications. But another common cause of gynecomastia is age. As I went through my 50s and 60s, my breasts gradually became more voluminous, larger, little by little. Why does gynecomastia appear as you age? The estrogen-testosterone ratio simply increases with age. Although we don't have an andropause as clear as menopause in women, our testicles are not the same at 30 as they are at 70, right? There is progressively less testosterone being produced, and this unbalances the ratio. To this contributes the fact that we are becoming more obese as a population, and the more fat, the more aromatization and more estrogens. Also, the increased presence of pseudogynecomastia, which is often confused with true gynecomastia. Not to mention that as we age, we have less and less muscle mass and do little or no strength training. Remember that strength training sensitizes you to androgens, it makes these bind better to the androgen receptor. And let's not forget the progressive exposure to endocrine disruptors, many of them, like microplastics, are hard for our body to eliminate and have a cumulative effect, so you're going to have a greater amount at 80 years old than at 20. And I conclude with a greater use of drugs in old age. Among those previously mentioned, many of them can produce gynecomastia, as you know. And now we're going to look at the diagnosis. How do I know if I have gynecomastia? Well, it's not a difficult diagnosis. You can tell by looking at yourself in the mirror. The most important thing on the part of the doctor is the physical examination, which should focus on exploring the glandular, not fatty tissue in the sub- and periareolar region. If there are doubts or you want to quantify better, a breast ultrasound can be done. And all of this should be supported by an analytical study that includes prolactin, thyroid-stimulating hormone LH, follicle-stimulating hormone sex hormone-binding globulin testosterone, and estradiol. Remember that diseases that cause gynecomastia must be ruled out, and therefore that analytical panel also has to be directed towards that goal. What can I do if I have gynecomastia? Well, let's look at lifestyle habits. There are fundamentally 4 things you can do to substantially improve this problem without getting into medical treatments. The first and most important is to lose body fat. This will not only eliminate fat deposits that contribute to that pseudogynecomastia, but it will optimize the ratio between testosterone and estrogen in addition to reducing the aromatization of the former. And you don't have to stay at 8% body fat. Often losing 5 to 10 kilos, gynecomastia resolves completely or almost completely. The second habit you should implement is strength training. Developing your pectoral muscles is the best thing you can do to disguise that glandular tissue, which will be more snug and distributed if there is a strong muscular belly underneath. That's why gynecomastia in bodybuilders tends to be quite well disguised, or at least much more so than in the non-athletic population. Then, stay away from the pharmacy products we mentioned, especially lavender oil or shampoos with lavender. Lavender is a supplement that when taken orally can improve anxiety, but remove it if you have this problem. And it's obvious that staying away from anabolic steroids is a necessary requirement to avoid gynecomastia. Lastly, some patients find it helpful to disguise it by wearing tighter underwear or a top, although this is very personal. And what is the real treatment for gynecomastia? Well, sometimes what you have to do is simply observe. As we have said, many times they resolve spontaneously. In this case, whenever gynecomastia appears in a teenage male, the most prudent thing first is to observe and wait a bit. When do I have to start giving a solution? When more than 12 months have passed and it remains the same or worse, and he has also already finished puberty, after medical treatment with antiestrogens such as tamoxifen or raloxifene. Clomiphene has also sometimes been used. Although they do not always work, a therapeutic cycle of 3 to 6 months with antiestrogens is appropriate when surgery is not considered. And finally, surgery, which should never be done before puberty, as the glandular tissue can regrow if it has not been completed. If the problem is already causing significant psychological distress or does not have a clear solution, the most definitive and effective treatment is surgical, usually performed by plastic and reconstructive surgery. Now you have more information to properly address gynecomastia. See you in the next video. Thank you very much for your attention. A big hug and keep empowering.